Welcome to Aging Gracefully on Suncoast FYI. I'm Nancy O'Neill. Dr. Sessa joins us to talk about fat grafting. Rachel Tulim dives deeper into acupuncture treatments, and Andrew Ford is here to help us navigate estate auctions. For a majority of us, there are certain areas of fat that we would rather not have. Dr. Sessa joins us in the studio today to discuss how to put some of that fat to good use with fat grafting. Hello, doctor. Welcome back.
Thanks. Great to be back.
So fat grafting, let's talk about that. And how do you treat something like that? What do you do with it?
So, very interesting. You know, fat has sort of been all the rage for the last probably 8 to 10 years in cosmetic surgery. It's a great volumizer. So if you think about it, if you look at the face, anywhere between the eyes down to the mouth, the middle part of your face, if you will, sort of loses volume as you get older. As you age, you lose volume around your eyes. The volume that you used to have in your cheeks sort of falls downwards and inwards and leaves these sort of depressions in and around the sides of your face.
Right.
So what we do is very simply take some fat from your tummy, from your thigh, any area.
Can your patients decide on where they want to take it from?
Yeah, of course, yeah. The bad news is that I don't take a lot of it.
Oh, okay.
It's a very small amount.
All right.
So a lot of my patients, you know, jokingly say, "Please take it all. Take as much as you want." But unfortunately, I only need, you know, maybe a small amount, maybe half a cupful.
Oh, darn.
So, but that goes a long way. So I take that fat. I don't treat it in any way. I just remove it under a procedure that's essentially painless and scarless. I just I compact it. So I put it in something that spins it down and compacts it, and then I inject the compacted fluid into the areas. Now, fat is very different than other volumizing things like you know, other products that you may have gotten that use hyaluronic acid, or other things that are sort of come out of a syringe to help fill in creases or wrinkles.
Right.
This is a little bit different in that all these other products are generally placed at a very superficial layer.
Right.
Fat is placed at a very deep layer. It's placed almost on the level of the muscle and the bone. So if you think about it, we're lifting the house. We're not just spackling a crack, if you will.
Okay.
So, so I could put in lots of fat and fill out your face. Now, the thing about fat is that a couple of things. One is that it's highly rejuvenative. It has a high amount of stem cells in fat. It's been shown that there's more stem cells in fat than in your bone marrow.
Wow.
So that is the rejuvenating aspect of using fat in and of itself. The second thing that's very nice is that it's your own substance.
Exactly.
Yeah. So you don't have to worry about any allergic reaction. It's not going to have some sort of untoward side effect because it's your own fat.
Right. No chemicals. It's
just no
yours,
chemicals.
So.
It's just you. Yeah, that's right. So the one caveat to fat grafting is that you will lose about 40% of it over the course of 3 to 6 months. But the good news is that of that 40% you lose, the rest of it you keep, and it's essentially permanent.
Okay. Can you do it again? Can you, when you lose that percentage, can you come back and have it done again? And then how long will that last?
Absolutely. So it's always going to have about the same longevity. The good news is I take the fat from problematic areas. Outer thighs, hips, lower stomach. As we get older, those areas are very difficult to lose. So the fat is very resistant to breakdown. Now, if we did the fat grafting and then all of a sudden you went on a crash diet and lost 30 pounds, more than likely you're going to lose that fat. But if you had that procedure done and you basically stay at the same weight that you're at, it will remain there, essentially permanent, barring any drastic changes in your lifestyle.
Okay. And what are some of the other things that you can expect to happen if you don't make any drastic changes in your life? I mean, what are the benefits? Obviously, is that your skin looks healthier.
Yeah. So the main benefit of fat grafting is the volumetric enhancement. It works really, really well when combined with other procedures. So most everyone, as we get older, it's not that, yeah, your skin is sagging, right? But it's that you've lost water in your skin, you've lost collagen in your skin, you've lost fat in and around your skin and structures. So now gravity takes over and now things are sagging. So if we do, let's say we do a facelift, let's say we do laser. So now we not only tightened up the muscle structure, now we also tightened up the skin and rejuvenated the skin, but now there's that sort of intermediary level. So if we add the volume, and we add volume and enhance the cheeks, cover up around under the eyes,
right,
maybe fill in the creases around your nose, it looks exponentially better. And the fat will stick around longer because the general structure of your face has been changed.
Has been improved.
So I'm not trying to rebuild what I just did by giving you surgery,
Right.
by just giving you fat. So volumetrically, you can enhance and rejuvenate someone's face, but it's less likely to last as long as if you had it combined with a surgical procedure.
Okay.
But it all works well, and I find a lot of people say, you know, it's not something, I'm not ready for surgery yet. I want to
Yeah.
do something non-surgical.
Yeah.
I consider fat grafting essentially non-surgical because there's no scars.
Right.
So, and it's an outpatient procedure that's performed under local anesthesia, and it works really well, and it gives people back that volume, and just that fullness and that volume is enough to make you look
And
5
feel-
to 10 years
and
younger.
feel better.
Yeah.
And these are all the types of things that when a client comes in for a consultation with
Yeah.
you, like again, you said you'll give them, you know, your suggestions
Yeah.
and work with them on what they're comfortable with.
Right.
Right? Okay.
course.
Well, again, always a pleasure seeing you, and we'll see you next time.
Thanks.
All right.
Look forward to it.
Stay tuned. Aging Gracefully. We'll be right back. Rachel Tuman is here today to go more in depth on the advantages of acupuncture treatments. Welcome back, Rachel.
Thanks. Nice to see you again,
Nice
Nancy.
to see you again. So let's go into some of the basic acupuncture concepts and some of the questions that your patients might have when they first come in to see you.
Sure. That sounds like a great idea.
All right.
Well, one of the first things that people want to know about acupuncture is, does it hurt?
Yes.
That's really scary to people. Oh my God, the needles, and they get really panicked about that. And so I like to allay those fears, make them feel safe very quickly. And one thing that I like to describe in terms of acupuncture is that the needles are so thin, it's like a cat whisker, really, and you could fit 10 acupuncture needles inside of a hyperbaric needle. When we think of needles, usually we think of a shot, right?
Exactly.
That's something that's hollow because something's got to pass through it. It's either going in you or coming out of you. So you've got to have something fairly thick for that to happen. An acupuncture needle is what we call filiform. So it's so thin, it actually doesn't cut your skin. It goes in between the cell walls. And it doesn't leave a mark, it's very tiny, and so sometimes if someone's very nervous about getting their first treatment, I'll say, well, let's just try it, and you can get that out of the way. And the response is usually, it's in, that was it,
That's it,
it's done,
that's
and
it.
so then we've kind of got that fear out of the way.
Okay. Well, that's why I was glad that you brought a needle with you today, because I've had acupuncture treatments, as I mentioned before, and that was one of my fears, because I don't like shots, and I don't know a lot of people that do, as you've
Nope.
said. So I was hesitant. So would you mind? I'll be a guinea pig today.
I'd be happy to do that. So this is acupuncture needles also are single use, they're sterile, and I can only use this needle one time, and then after that it gets disposed of. Like any other kind of, I'm just going to have you rest your arm here,
Okay.
like any other kind of medical waste, and it gets burned at 1500 degrees until it is no more. So that's another concern that people have. So we just tap it in, and there it is.
It's done.
It's done, it's in there. It's so thin that see, it's just this flimsy thing.
Yeah.
In fact, it's so thin, what I use is a guide tube to put it in because it's so thin. It wants to bend, just trying to get through the barrier of the skin. And this guide tube is just a little bit shorter than the needle, but it holds it rigid so that I can get it in, and then it's done.
So it only goes in, what, about a eighth of an inch, quarter of an inch?
Well, that actually varies depending upon what I'm doing. So there's different energies of the body, and they're at different levels. So if I'm trying to access the immune system, that's sort of like your shields up to keep you from getting a cold or a flu or something.
Right.
Now that's more closer to the surface of the body. And if I want to interact with an internal organ, I need to go a little bit deeper. Never piercing anything important,
Right.
but yes, there are different depths and different ways to use the
Now,
acupuncture needle.
what happens during a normal acupuncture session, and how long do you leave the needles in?
Okay. Well, the first visit, I spend an hour and a half with my patients. So we spend about an hour of that going over your entire health history. What has happened in your life that got you to the place that you are now in terms of your health and well-being?
Yep.
And so it's everything. It's about how your body functions on a daily basis. It's about every trauma you've had, every surgery you've had, if you've had any motor vehicle accidents or slipped and fell when you were a gymnast in high school or all
Whatever.
of that. There's nothing irrelevant.
So how does someone know whether this will work for what they have?
That's another really important question that people have, because once you get past that, oh my God, it's a needle, and the next
And it
is
didn't hurt.
and it didn't hurt,
Just
and
so
there was
you know.
nothing to it. The next thing is this going to work for what I have? And acupuncture was the system of medicine in China for 5,000 years. It treated everything. That was what they had,
Right.
and it treated it well. So everything from chronic headaches or migraines to neck and back pain to digestive issues, irritable bowel syndrome, esophageal reflux, cancers, all kinds of things.
So people can come in and ask if you can help them with their specific condition.
Absolutely.
And also in asking you that, how do they know that you've been trained to treat that specific condition?
Well, in the United States, acupuncture education is very extensive, and so it's a minimum of 2 years of undergraduate plus 3 to 4 years of acupuncture education, and it's very in-depth. I liken it to medical school, but sort of upside down and backwards in Chinese. I need to understand everything about modern medicine, all the tests that you've had, the medicines that you're on, the surgeries you've had, everything about that. But then at the same time, there's a different way that we have in Chinese medicine of looking and evaluating the body and understanding how different things that seem like they're separate are actually a systemic thing. So for instance, if someone comes in and they have bad knees, maybe some arthritis, they've got chronic allergies, they're depressed, and some kind of vision problem, maybe cataracts. Their eye doctor doesn't need to talk to their psychiatrist, who has nothing to say to their orthopedic surgeon, who doesn't need to discuss anything with their allergist.
So you approach it all from a holistic point of view.
Absolutely.
And why not start there than taking medicines if you don't need to?
Oh, that's my favorite, is when somebody comes to me first. But very often, because of this whole needle fear, acupuncture is the last thing. We've tried everything and nothing's
Should be
working.
the other way around.
And So finally, all right, I'll try this. What have I got to lose?
Okay.
And then it works, which is
Okay.
always even more amazing
Great.
because there have been so many other interactions,
Thank you.
and yet this is what's made a difference.
It's made a difference. Wonderful. It's never enough time to spend with you, and we'll have you back again, right?
Thank you so much, Nancy.
Okay. Thanks, Rachel. Aging Gracefully on Suncoast FYI. We'll be right back. We welcome Andrew Ford back to the studio today to share more on estate auctions. Andrew, thanks for coming back.
Thank you for having me.
I know that you have an estate auction coming up soon. Could you tell us the date and where the location is?
It'll be held at our north address, 6030 North Lockwood Ridge Road.
Okay.
The time is 11 a.m. on January the 14th.
Okay, so next month, and that'll be coming up pretty quick the way the days are going by.
Absolutely, with the holidays for sure.
Now, is it a public auction or is it a private auction?
Our auction is open to the public, so anyone can come down, sign up to register and bid with us, and they can spend the afternoon with us.
Okay, and if they can't make it there, are there other ways that they can bid?
Thank you for asking. You may call in a bid. That's a good possibility. You can also bid online through our website. So there are multiple ways to leave a bid with us if you're not able to make it that day.
Okay, so everything that you have in your auction then is going to be listed on your website so viewers can go through and see what you have and see if there's anything that they're...
Generally, about a month out, we have the auction up on our website.
Okay.
It should be ready in the next couple of days for viewer.
Okay. So this auction then, obviously, since it's coming up, you're probably not accepting any more pieces for this show, but we'll talk about how they can get into the next show in a couple minutes, okay?
Absolutely.
All right. I'd like to get to the painting that you brought today
Sure.
because this is just fascinating. Can you tell us about it?
The artist is Hilton Leach. He was probably the most important local artist we have today. The Ringlings hired him in the early 1930s to run and open the Ringling School of Art. So he was here in the 30s, 40s. He went away for some time during wartime and went on to become probably the most prolific artist here in Sarasota.
Now, is this one of the pieces that are going to be up for auction?
This will be in the auction on the 14th, yes.
All right. Because I work for Ringling College, you know.
Of course, of course.
That's why you brought this, didn't you? You did that on purpose.
This is an image of South Lido. This is titled The Watchers, and it's a larger image for his work. Generally, he was working on a smaller scale, so this is one of his more quintessential images.
Okay, and what year or
I believe
range?
this one has an exhibition label on the back of 1954, so I suspect it was done just previous to it, maybe 1953.
Okay, all right. Now, getting back to, unless there's anything else you'd like to tell us about this.
No.
You're good? Okay. Our viewers who would like to consign something for your upcoming show, which is going to be?
February 28th will be our
Okay.
next sale.
And how far out do you like to get the work?
Generally, we'd like to get things about 30 days in advance. It gives us time to catalog and photograph these objects.
Okay.
If it's a particularly important painting, we may take an ad out on it. We need time for all of that.
Sure, sure. And again, these are things that if somebody is either downsizing or, you know, just want to get into a different type of genre of artwork in their home,
Sure.
this is a perfect venue
Very definitely.
for them to do that, is to come and see you. And
Sarasota in general has been, involved in the arts for so long that many of these pieces have been acquired here locally. In fact, his estate came up for sale here approximately 20 years ago, so it wouldn't surprise me if many of your viewers have these paintings in their own collections, and should they want to sell them, we can perform very well at auction.
okay. And when they come in, like you said, you're a certified appraiser, so you can give them an idea of the value and what they can expect to receive in an auction
It's
setting.
very important to understand fair market valuations.
Sure.
The markets fluctuate. The art market is pretty stable. So it's important to come check ahead of time and find out if this particular style or genre is in vogue currently. Of course, this is more in the modern style, which is really all the rage these days.
Now, I know you mentioned last week you were looking for Oriental Asian pieces.
Always
is there
looking-
anything else that?
Always looking for a good European French and Italian is a big market that we have. So anything European, but certainly the Asian market is our hottest market currently. Also Indian artifacts, Indian, Sri Lankan and Indian artifacts, religious pieces from that area are doing very well on the auction block.
All right. And one final question. Do you buy directly or do you just take things on consignment? Or
We
do you-
consign, we also buy outright. Sometimes it's a little easier to buy the items immediately, and people will know on the front end what they're going to receive as a check.
Okay.
Some people like to gamble and try it at auction. They prefer to let it ride at auction.
Yeah.
And so it just depends on your theory.
Okay. Now, what if it doesn't sell at the auction that you're holding?
Generally speaking, if it doesn't sell at the auction, we get it back to the customer. We can always run it through one of our discovery sales later. Generally, we yield on the price to some degree as far as the reserve is concerned. It might have been too high a reserve, or just might not have been the right audience that particular day.
Right, exactly, because that's, you never know who your audience is going to be.
Absolutely.
So they should always try it again, possibly, if it doesn't sell the first time.
We've had many examples where we didn't have any bidders on it one time, and then it really performed properly and sold for 3 times the estimate. So one never knows who's looking that particular week.
Exactly, or who might come in, yep. So, one more time, your website and your location.
SarasotaEstateAuction.com. Our location is on the corner of University and Lockwood Ridge Road.
Okay,
Easily found about 3 miles outside of downtown location.
great.
Our opening sale is 11 a.m.
All right.
January 14th, and
Great.
we look forward to seeing you out there.
All right, thanks, Andrew.
Thanks
It's great
so
having
much.
you back.
Absolutely.
Thanks for joining us on Aging Gracefully on Suncoast FYI. If you missed an episode, you can view it online at snntv.com under Aging Gracefully. We'll be back with new episodes in the new year. All of us here at SNN wish you and your family a safe and happy holiday season.